Oral cancer, also known as mouth cancer, is cancer of the mouth and lips. It affects almost 400,000 people per year worldwide. But there are steps you can take to reduce your risk of developing cancer. In this video, we present causes of mouth cancer and ways to reduce your risk.
So, first of all, what is mouth cancer? Mouth cancer is a cancer that develops in the mouth. It can consist of cancer that is present in the tongue, lips, gum, roof of the mouth, and inner cheek. And it usually manifests in the form of tumors and cysts in these areas. This cancer can show itself with multiple symptoms. Soreness and lumps in the mouth could indicate cancers, as they can indicate tumors growing in the lump. White or red patches in the gum of your mouth that last for 3 weeks or more could be an early sign of cancer. And lastly, if you have consistent pain in your mouth, if you have a swelling in it that is growing, and if you have a bleeding in the mouth that does not stop, you might be suffering from mouth cancer. However, note that for most people, these are indicators of much more benign diseases. And always consult a physician if you suspect you are suffering from mouth cancer.
Now, there are a lot of underlying causes of oral cancers, but most of them can be easily preventable. Here we highlight the most common underlying causes. Firstly, alcohol, smoking, or chewing on tobacco or betel nuts can all contribute towards the development of oral cancer. A second factor that increases the risk of oral cancer is the lack of dietary balance. Specifically, the overconsumption of red meat and fried foods can be very detrimental. However, vegetables and fruits can increase the amount of antioxidants in your body and reduce your risk of developing cancers. Thirdly, prolonged exposure to sunlight can also cause damage to the mouth and lips, which is a significant risk factor as well. Now, as mentioned earlier, the human papillomavirus is also likely to cause mouth cancer. Although a healthy immune system might be able to fight off the infection, it is easier to simply prevent the infection from developing in the first place. And this can be easily achieved through HPV vaccinations at your local pharmacy or clinic. Finally, people with a family history of mouth cancer have a higher chance of developing this disease. However, this is a much lower risk relative to the ones mentioned earlier in the general population.
Now, since we discussed the risks of mouth cancer, we can go into the actions we can take to reduce the risk of mouth cancer. The risk of mouth cancer can be greatly reduced by avoiding tobacco use and by cutting down on alcohol consumption. Research has shown that both of these factors contribute to cancer, and so it's not enough to only eliminate one. Please keep in mind that for mouth cancer, both chewing and smoking tobacco are dangerous, since the mouth gets exposed to the toxins that damage the DNA in tobacco when using chewing tobacco or smoking it using cigarettes. Plant based nutrition is one of the strongest methods to prevent and fight cancer in general. Legumes are protein powerhouses. Vegetables and fruits contain antioxidants, and grains provide fiber. Use your food to work for you. According to research, about a third of lip cancers are associated with excessive sun exposure in patients, especially in people with fair skin who work outdoors. To prevent the development of cancer, sun protection is critical. This includes using a lip balm containing sunscreen, wearing a wide brimmed hat, and spending time in the shade when the sun's UV rays are strong. These steps will help protect the skin from damage from the sun's radiation. Next, dental care is critical to keep your mouth healthy, diagnose any symptoms, and prevent the development of cancer. Dentists are trained to recognize any early signs of cancer, so getting your mouth checked up regularly can help uncover any symptoms in their early stages.
Chewing and biting on the lips repeatedly, which may be more common when they are chapped, can also act as a trigger for lip cancer. For that reason, another tip is to keep your lips moisturized so they don't chap or crack. Lip balms containing beeswax, cocoa butter, or lanolin are effective. However, petroleum-based lip balm is not recommended. Apply lip balm throughout the day, as well as after brushing and flossing your teeth, and before sleeping for the night.
Hope the tips we provided can help you take better care of your oral health. Thank you for listening and have a great day.